start by a backdrop. This is a slide that comes from Don Berwick, who was the individual that created the Institute for Healthcare Improvement in the States. He was also the head of Medicare and Medicaid services in the US. And what he says in this slide, which he calls the wedges of waste, is that there is a rising percent of the gross domestic product, in this case in the US, spent on healthcare, but you all know that we are close to 12% of our gross domestic product and rising in Canada too. But the most important thing is he says that if we're going to spend this amount of money, which is for a social good, we want the dollars to count, to add value to the patients that we serve. And what's, sort of a sad irony is that despite the rise in costs of healthcare in the States and in Canada, we haven't necessarily seen an improvement in quality, and some of the dollars we invest don't add value because we don't have coordination between us. And a big wedge of waste in Don Berwick's slide is overtreatment, and I would call it overdiagnosis and overtreatment. So this campaign is Choosing Wisely Canada is designed to help, and the words on this slide are very important, to help engage clinicians and patients in conversations about unnecessary tests and treatments and help them make smart and effective care choices. This is about making the right choices for the patient at the time with the conversation about maybe you don't need that MRI or maybe you don't need that more expensive and not necessarily adding value drug. So it's at the point of care and it's framed as stimulating a conversation. What's not on this slide is cost. It is really not the primary frame of Choosing Wisely to get costs under control. But we know that a lot of the things that we're doing will decrease costs. But we don't think that's the right framework. We think that doctors want to do the best for the quality of care, prevent harm for patients, and patients also want that. They don't want to feel that we're rationing based on a cost objective. So what's really unique about Choosing Wisely is that this is not a top-down approach. This is a bottom-up approach led by clinicians. It is really a culture change. I can tell you that in my entire career, I have never seen a serious conversation between physicians about what we should stop doing or what we do too much of. We add new things, but we very rarely question the things we do and ask, are these things we should be stopping? A moment about the international campaign, it's pretty interesting. One would say, as a health policy person, things don't translate between the US and Canada and the European countries because we are in such a different environment in terms of how physicians are paid and et cetera. But we have Australia, New Zealand, South Korea, Japan, Brazil, many of the European countries in this consortium, and we didn't go find them. They came to us to say, how are you doing this? And I think what is the powerful part of that is the practice of medicine is the same, and physicians have these conversations with their patients on a daily basis all over the world, even though the reimbursement systems and all the way healthcare is structured is so different. The core essence of doctoring and being with patients is the same, and so it has really broadly resonated. But then there's a lot of patient education. We don't think you can change the relationship if patients don't understand that more is not always better. So where are we going? Our goal initially was to get the engagement with the medical societies so they could in turn educate their providers. Now I think we're moving on the provider side, and as opposed to guidelines and complicated things, the uptake on this has been striking. And as I mentioned, we have this remarkable energy around putting Choosing Wisely into practice. A second whole plank is around the patient education. The more is not always better. And then we're working very hard on trying to engage the student and resident community so that in 25 years, people have a different kind of dialogue and ask the question routinely, Is this a test or a treatment we should be doing? Are there harms from this? Maybe we shouldn't be doing this. We would love it if every conversation on the wards in the hospitals where we train our trainees had that kind of conversation going on, so we could make best choices for our patients, doing the right tests and avoiding the wrong tests or treatments that might even be harmful.